This is the first webinar in a series that covers calcium and phosphate homeostasis. The first part is going to cover basic overview of calcium and phosphate, their general functions in the body, clinical manifestations of too high or too low. Specifically, we're going to be talking about calcium and the role of various body systems in the maintenance of calcium. So even though the title of the lecture is calcium and phosphate homeostasis, we do spend most of the time talking about calcium maintenance. Now, over the course of evolution of living things, from going from a seawater environment, which was very abundant in calcium, to more of a terrestrial environment where it's relatively scarce in calcium, we have evolved a number of mechanisms for closely regulating and conserving calcium. So why have we done that? Why do we want to carefully regulate and conserve calcium? Well, it serves a lot of functions in the body. So I have a few pictures to kind of try to depict some of the many functions that calcium plays in the body. It is very important in muscle contraction. It is involved in cell signaling. So in biochemistry, you probably learned about the IP3 receptor and its role in calcium signaling. Also, when we talk about calcium calmodulin is involved in smooth muscle contraction, but it's also, calcium calmodulin regulates a number of different enzymatic pathways or metabolic pathways in the body. It's a very important part of the skeleton. This picture is trying to demonstrate its role in blood clotting. It's important in cardiac muscle. So it has a number of different functions in the body. So we carefully or tightly regulate the levels of calcium, and specifically in the extracellular fluid. So what happens if the calcium is too high or too low? Well, there's a number of different things. This list is including both high and low calcium levels in the body and what could happen. You could have dysfunction of the neuromuscular system, affecting reflexes, affect how muscle contracts. The central nervous system will be affected. Kidneys will not function properly. You may calcify soft tissue. Could cause disorders within the skeleton. So a number of different things. We could even add blood clotting issues here. So let's just look at calcium in regards to being too low. So hypocalcemia means the extracellular fluid levels of calcium, specifically in the blood, are too low. And so this lists a number of different signs or symptoms of too low blood calcium. It does cause hyperexcitability within the central nervous system. So reflexes will be exaggerated. This also can lead to involuntary muscle spasms. Remember that skeletal muscle is controlled by the nervous system. So if the nervous system is hyperexcitable, it can cause skeletal muscle to contract involuntarily. And we're going to show you what a carpal pedal spasm looks like very shortly. Thing that I have to mention, even though we didn't talk about it last trimester, I may have mentioned it, but a lot of people don't realize that calcium has a stabilizing effect on voltage-gated ion channels. So if the concentration of calcium in the extracellular fluid is too low, these channels start to open just spontaneously, causing nerve cells and muscle cells to become hyperactive. In skeletal muscle, remember, in skeletal muscle, the calcium needed for the excitation-contraction coupling, the sliding filament theory that we covered last trimester, the calcium needed for binding to troponin C, which then causes a conformational change and allowing tropomyosin to move out of the way, and then actin and myosin interacting, and everything on from there. All that calcium is found in the sarcoplasmic reticulum, which is found, it's an organelle found within inside the cell. So some people start to think that, well, if blood calcium levels are too low, you would have skeletal muscle weakness. But remember, the calcium needed for skeletal muscle is already inside the cell. Where it becomes a problem is changes within the extracellular concentration of calcium affects the nervous system, which also affects the excitability within the muscles themselves. Now also, calcium plays a role within cardiac muscle. Well, calcium is very important in cardiac muscle contraction. Cardiac muscle does not have as well developed sarcoplasmic reticulum, so it does depend more on the extracellular fluid levels of calcium. So, in response to low calcium, cardiac contractility decreases. And another thing that you can pick up on an ECG is the QT interval is prolonged. And this picture is reminding you what the QT interval corresponds to. What could affect or result from a prolonged QT interval is that indicates, or it's a marker for myocardial instability, which can lead to ventricular arrhythmias, syncope, and sudden death. The low calcium also could impair blood clotting. This trimester, we're going to learn about the coagulation cascade. Calcium is a necessary cofactor in a number of the steps involved in coagulation. So people who have low blood calcium may have a problem with blood clotting. You also will associate hypocalcemia with increased phosphate in the urine. Right now that doesn't mean anything to you, but just as one of the things that you may observe if someone's low in calcium. What I want to show you is kind of the what it looks like with the CNS hyperexcitability and these involuntary muscle spasms. These are a couple tests that can be used for diagnostic purposes. The first one, the Phosphate sign, what they will do is they will tap the facial nerve. And if the facial nerve is tapped, with people with hypocalcemia, that the facial muscles will contract momentarily on the side in which you tap it. It's caused by the hyperexcitability of the nerves. But keep in mind, though, about 10% of the people who do have a positive sign will be normal calcemic. They have normal calcium levels. Another one that can be used for diagnostic purposes is something called Trousseau's sign of latent tetany. What they will do is they're going to inflate a blood pressure cuff on the subject's arm about 20 millimeters of mercury above their systolic blood pressure and hold it for about 3 minutes. Now it's extremely uncomfortable, but they do that. We'll show you what the carpal pedal spasm looks like. Having that hypoxia in that arm will unmask, or that ischemia will unmask, the increased excitability of the muscle. So we'll show you that. Now this one's a little bit more specific, but because only about 1 to 4% of the subjects that are normal will have a positive sign. But just always remember that if you see this, does it automatically mean the subject has low blood calcium levels? You'd also have to do blood tests to be able to confirm that. So let's kind of look at what it looks like. So this is the Phosphate sign. They're tapping the facial nerve, and you see the muscles contracting on the same side. Now here, they've got the cuff pumped up. We're just going to watch at the subject's hand. The carpal pedal spasm that you're seeing, what happens is you get flexion of the wrist and flexion of the metacarpal phalangeal joints, extension of the interphalangeal joints, and adduction of the thumb. So we'll kind of show you that again. If I can get back to it in a second, because it goes pretty quick. Now watch his hand. Thumb's adducting, Starting to see the flexion in here. Just keep watching. That's a carpal pedal spasm. Alright. Now, on the other hand, if a person has hypercalcemia, you can see some of the opposite effects. They're hyporeflexive. It depresses the nervous system because it's going to be harder to open certain ion channels, the voltage-gated ion channels. It can have effects within the GI tract. They get constipated. They don't want to eat. Too much calcium can result in calcification of body tissues, so it could end up with calcification of the smooth muscle within blood vessels, which could result in stiffening of the blood vessels and high blood pressure. It can lead to kidney stones. The QT interval, instead of being prolonged, will be short. So a number of different things can result of hypercalcemia. And a little mnemonic that a lot of people learn for the effects of hypercalcemia, they call it stones, bones, groans, and moans because of its effects on the bones, the kidney stones. Groans is they don't feel well, the GI tract. Moans because it also has effects on the central nervous system in regards to mental systems like lethargy and behavioral changes. So those are some of the effects of hypercalcemia. Now before we go on though, if someone has hypo or hypercalcemia, that is not really, you can't really say a diagnosis. It is it's a sign where, you measured, they've got high or low blood calcium when blood tests are done, but you have to figure out why the calcium is too high or too low. So they could have hypercalcemia for a number of different reasons. They can have hypocalcemia for a number of different reasons. So you have to address what's the cause of the changes in calcium. So let's just go further in looking at where the body calcium and phosphate are distributed and the role of various body systems in maintaining normal levels of calcium. So when we look at total body calcium, most of your calcium is in your skeleton, and most people would have been able to answer that for me if I had asked them. The majority of your total body calcium is found in the skeleton. It's a very important component of giving the strength to the bones, but it also serves as a reservoir for calcium. The remaining calcium is either found inside the cells, about 1% of your total body calcium is inside the cells, like it's in the mitochondria, it's within the cytoplasm, a number of different places. And then the very small percentage, 0.1% of your total body calcium is found in the extracellular fluid. So I'm going to zoom in on that part. So plasma is part of your extracellular fluid. Now of that calcium that's in plasma, some of it is free. It's ionized. It's positively charged. Some of it is physically bound to either plasma proteins or negatively charged ions, or your anions like bicarbonate. You have calcium bicarbonate, calcium phosphate, calcium lactate. So when you look at overall total body calcium, most of it is found in skeleton. The smallest amount is found as an ionized form, free ionized calcium, which is part of the extracellular fluid. But the interesting thing is, this is the calcium that our body regulates. This is what causes the signs and symptoms that we have in regards to the changes in the nervous system, the blood clotting, the changes in the muscular system. If you change the free ionized calcium, that's what causes all the problems. This is the quantity that is tightly regulated by hormones such as vitamin D, and parathyroid hormone. Now, if we look at that again, so this is showing you, again, the calcium that's in the plasma. We have the free ionized, we have that bound to the proteins and some complex to anions. This equilibrium can change. You can shift ionized calcium to be more bound or less bound to calcium or to proteins or anions. So under certain conditions, your total body calcium may be perfectly fine, but the distribution may be altered. You may have signs and symptoms of hypocalcemia, but your total body calcium levels are not affected. It's because perhaps your ionized calcium is there's more bound to the proteins or complex to anions. So we're going to give you some examples. One of the things that can affect calcium binding to proteins is acid-base imbalances. And you'll notice I've listed acidosis. If you're acidotic, what happens is the calcium binds to the proteins less tightly. And so what results is your free calcium levels will increase. So that could lead to signs and symptoms of hypercalcemia. On the other hand, alkalosis has the opposite effect. It binds a little more tightly to those proteins. So the amount of calcium that is free in the extracellular fluid decreases, and you have signs and symptoms of hypocalcemia. So I'll give you a correlation, something that you've heard about before, maybe with Dr. Giggleman in Try 1. If someone hyperventilates can cause a decrease in the ionized calcium in the plasma to the point a patient becomes symptomatic. They have twitching, numbness, tingling. So why did that happen? Well, if you hyperventilate, you're blowing off a lot of carbon dioxide. And when that happens, you can become alkalotic. And this is something that we're also going to discuss this trimester. So hyperventilation can lead to what we call respiratory alkalosis, which can lead to signs and symptoms of hypocalcemia. And the story that Dr. Giggleman may have told you is during childbirth with his wife. She was hyperventilating, and so she started to have the symptoms of hypocalcemia, the carpal tunnel spasm. She may have been twitching, numbness, so they just asked her to breathe into a paper bag. Another example of how if the distribution of calcium in the plasma changes can cause symptoms of hyper or hypocalcemia is a good example would be if you change the amount of these anions. Citrate and phosphate are negatively charged. They're going to be attracted to calcium. So if you have an increased level of either of these two in the blood, it's going to bind to the calcium, and your free ionized calcium will decrease and cause symptoms of hypocalcemia. So an example would be if you have a extensive tissue damage. Now, tissues contain about 10 times more phosphate than they do calcium. So if you damage a tissue and you have massive cell death, a lot of phosphate can be released into the blood. Hyperphosphatemia will result in the acute hypocalcemia because the increased phosphate complexes with the calcium. So these are things that can affect the calcium distribution. So again, I'm going to emphasize it's the free ionized calcium in the blood that we will closely monitor and which are going to be subject to regulation by various hormones. Now, phosphate, just like calcium, the majority is found within bone. And you don't have to worry about memorizing these percentages, but it follows the same pattern as calcium. Most of it's found in the bone, next greatest amount is intracellular, and then the smallest amount is within blood. Now, just think about some of the functions of phosphate. You know it's a component of ATP. It's involved, phosphate, when you phosphorylate enzymes, we knew it was involved in regulation of enzymatic pathways. It complexes with calcium as part of that mineral phase in bone. Phosphate will be an important component of some of the buffer systems in our body. So phosphate does play a role in various body systems, but we're going to spend a lot more time talking about calcium. Now, various organs involved in homeostasis of calcium and phosphate. The three major organs involved will be the GI tract, which you see to the left, your bone, and the kidneys. Okay? So let's just for sake of just ease, we're going to talk about calcium now. We take calcium in within our diet. Number of different ways. Doesn't have to be by dairy, it could be by a number of different ways you take calcium in your diet. We absorb it across the GI tract. Not all of it, okay? But we absorb a certain amount of calcium across the GI tract. What's not absorbed is excreted. We do lose some calcium through various secretions from digestive juices, so we do lose some by normal secretions within the GI tract. That calcium that we take in and absorb is going to help in maintaining this extracellular fluid level of calcium. Some of that calcium is going to be used to be deposited into bone, gives bone the strength to it. If necessary, the calcium within the bone can be released to help to maintain extracellular fluid. Now, within the bone, we do have kind of that mineral component, the hard component. They're really called the hydroxyapatite crystals within the bone. But we also have a pool of calcium that within the bone that we can rapidly mobilize and get some calcium or replenish calcium from that pool within a few hours. But if we need to be, you will go and start to break down the skeleton to increase the calcium to try to prevent hypocalcemia. So the skeleton is a very important reservoir for calcium. And something to keep in mind is that the maintenance of calcium in extracellular fluid takes precedence over strength of the skeleton. Okay, so that is more important than maintaining the structure of bone. But okay, so let's go back. The calcium is absorbed across the GI tract. It's going to be used to help to maintain the extracellular levels of calcium. Some of it's going to be used in bone maintenance. And we do bone remodels. We build it, break it down, build it, break it down. Kidneys. Now, at some point in time, the blood moves through the kidneys, and we do filter the blood. Most of the stuff is filtered. Later on, we'll tell you what is and what isn't. But there's calcium that's going to be filtered in the kidneys. We were going to reabsorb as much as we possibly can under certain conditions. But we can regulate it if we need to. We're not going to reabsorb as much to get too much calcium. It will be excreted in the urine. But we do try to, whatever we filter, reabsorb. So the kidneys also can play a role. So we're going to show you later the role of various hormones and how they affect the step in regards to absorption, how they may affect bone remodeling or modeling, how it may affect reabsorption in the kidney. But they're all going to be involved. Now, phosphate, I do have to mention phosphate again. Phosphate is absorbed along with calcium across the GI tract. Kind of think of it, they're going to be attracted to each other. You got a positively charged and negatively charged. They're kind of both absorbed across the GI tract. Phosphate is an important component of bone. And also phosphate is filtered by the kidneys and we can increase the amount of reabsorption or decrease the amount of reabsorption if need be. Now bone, since we did mention bone, I do have to talk about how important bone is in calcium maintenance. This little pie graph kind of shows you the distribution of various ions within the bone, and also organic compounds. So you have the organic compounds, mostly collagen, then you've got the inorganic components of bone. Now if I need to increase the blood calcium levels I can break down bone to try to get to this calcium, but what's going to be released also is some of the other components like phosphate. But if I want to build bone, I'm going to put calcium and phosphate and other things into bone. Now this picture is a slide that you may remember from Cells and Tissues that's going to look at the cells that are important in bone formation. And this is the fancy term. We talk about bone formation. Bone accretion. Accretion is just a term that refers to when you increase the size of something gradually by steadily adding smaller parts. So as we're steadily adding parts to the bone, that's bone accretion. The two cell types that are important in bone accretion are osteoblasts and osteocytes. So if you notice, right along the edge here, these are the osteoblasts. Here, these are the osteocytes. So the osteoblasts are cells found on the outer surface of bones and also in cavities, bone cavities. They're responsible for bone formation. Okay, they're going to be producing the osteoid, which is the organic component of bone, like mainly collagen, and it also promotes mineralization of the bone. The osteocytes are really osteoblasts that have become trapped in the bony matrix. They cease to make osteoid and the matrix, but they still play a role. They are considered to communicate with osteoblasts in a paracrine fashion, that they somehow produce factors that communicate with the active osteoblasts. So these ones are going to be important in bone accretion. On the other hand, you have osteoclasts. Now the osteoclast, here's an osteoclast that just got within the section, it just got knocked away. But you'll notice there's this little indentation in the outer part of this bone here, because the osteoclast is involved in bone resorption. Now that's a term, don't confuse resorption with reabsorption. It's resorption. When you resorb bone, you're breaking it down. So what are the osteoclasts and how do they do it? Well, they're very large, they're fairly large, phagocytic, multinucleated cells. They have about 50 nuclei per cell. They have villi, which I was trying to depict here. They have these little extensions that secrete proteolytic enzymes and acids, which digest and dissolve the organic matrix. So the enzymes are going to break down the organic matrix. The acids will help to dissolve the bone salts. So the osteoclasts are going to be very active in the breakdown of the bone. So when we discuss what happens under certain conditions in the role of various hormones, we're going to be going back to this roles on osteoclast and osteoblast activity. So this is going to be the end of the first part of this lecture. The next part will cover the hormonal regulation, looking at the role of parathyroid hormone, vitamin D, and calcitonin.